Welcome to the CashPT Lunch Hour. This is Aaron LeBauer with LeBauer Consulting and the CashPT Lunch Hour. And today I have an amazing guest. Her name is Dr. Nicole Coleman. Nicole is a pelvic core specialist, and she's a physical therapist and been in practice for a longer time than I can remember because I haven't known her that long. And I'm excited to have her here on the show to share some insights in cash-based physical therapy, insurance, a little bit about what she's doing, building her business and her online presence. And so, Nicole, thank you so much for being here on the show today. It's a pleasure to have you.
Thank you, Dr. LeBauer, Aaron. I feel very honored to be an invited guest to your show. I listen to your podcast all the time, so it's a little surreal right now.
Yeah, that's awesome. Well, thank you. I've had a pleasure to get to know you over the last, maybe 5 or 6 months, and seen some amazing changes and transformations in your business and life and what you're doing. And so I want to talk about that for a minute, but I also want to talk about, a conversation we were just having the other day about insurance and how, just kind of the transparency of insurance and how patients don't always see what the other side looks like. And so I'm excited for that. And we'll get to those questions, because first I want you to do is just tell us a little bit more about you. Like why did you get into PT in the first place, and what have you been doing for the last few years, and where, what brought you to this point?
I have always wanted to help people, and I took some time discovering what that medium would be. I wanted to go into medicine as a young student at the University of Michigan. That was my first intent, was to study medicine, because I saw that it had wonderful capacity to help people. And I went through and explored several options during my undergraduate years. I ended up studying movement science, which is part of the kinesiology division, and found that I was much more interested in movement and nutrition and the human body. And I realized that physical therapy was a better way for me to connect with and help people, because I would have more time to spend with them, and I would have better solutions than a pill or surgery. And so the very first day I observed physical therapy, I knew right away, after observing so many other healthcare professions, that physical therapy was my calling. On the very first day, I knew that. So that's when I decided I was getting ready to graduate after 4.5 years as an undergraduate student. And I applied on the very last day that I could to one school for PT school. And the reason I only applied to one school was because I reached out to all of the schools in Michigan, and they were the only one that responded in a way that I felt was congruent with how I wanted to move forward. So on the very last day, I applied, and just kind of had a knowledge that it was all going to work out, because it was a calling. And then I got the acceptance letter on my birthday. So I just knew everything was kind of meant to be. And then I studied physical therapy from there. And early on in physical therapy, one of my best friends told me, Nicole, there's this thing, it was the buzzword 8-10 years ago, was women's health. Nicole, you really need to look into this women's health, because it's just you. It has your name just slapped right across it, and you need to check it out. So I went to a student event, student conclave that year, and Christina Holliday actually was doing a presentation about women's health pelvic floor. What is it? What do they do? And the first thing she said was, well, you talk about poop, pee, and sex all day, every day. And everybody kind of awkwardly giggled, and, it was a great opener. And my brain just went, yeah, that's my calling. I've always been that friend who would ask my friends about those types of things. So it was just within my personality. So even in PT school, people knew me as like that pelvic floor girl, and that women's health lady before I ever even started specializing. Then after I graduated, I got into the specialty and I went through the pelvic floor series through Herman and Wallace, and immediately began practicing pelvic floor and knew it was my passion. And 4 years after I graduated, I had the opportunity to do it full time at Michigan Medicine, previously the University of Michigan Health System, with a mentor, someone who had started the program at the University of Michigan Health System, now Michigan Medicine. And so I went for it. And just last year, I became board certified. And one step further, I wanted to open up my own practice. And that's when we connected. And I found out about the CashPT Nation. You reached out to me through your very amazing marketing to learn more about your upcoming boot camps and mastermind events. And you invited me after a conversation to join in. And I just knew I had to get there. So I made it happen, knowing that I might even get fired by going.
I remember that.
So I didn't want anyone taking pictures of me, putting me up on social media, because I called in sick because there was no way for me to get the time approved off. And the very first day we were there, within about 20 minutes after doing the hot seat, I realized I don't want to open a CashPT practice. I want to have even more impact. And it's taken a while for me to figure that out. But my main goal is to help physical therapists help other people become better at moving, taking care of their bodies, having decreased pain, and improved quality of life. And I'm doing several things through that to reach out to physical therapists to help them be more successful at what they're already great at.
Yeah. So how did you get to that point, like of realizing that in order to make the impact that I want to make, I can't just do it, one patient at a time. I have to actually multiply myself and teach other people?
How I was able to see that was by hearing the stories at the mastermind event in the hot seat of these other physical therapy practice owners talking about how amazing it was to get back to what they loved, which was one-on-one connection. And I had been struggling for some time with feeling like that wasn't the best fit for me. And I was trying to fit myself into that mold, into that box. And being in a completely vulnerable situation, this was a big mastermind event with Greg Todd, yourself, and Paul Goff. And it was a very scary yet exciting opportunity to be vulnerable and have the opportunity for people to reflect back to you what you're thinking. And so hearing that those other physical therapists, by owning their own practice, they got back to what they loved most, which was that connection with the patient. My brain went, that's not what I really want. So I don't think I'll be happy if I open up a practice, because I want to have impact on more people. And if I treat one-on-one patients, which would be the only way I would ever do it, the most I could treat, which was at full-time capacity as a full-time employee, was 35 patients a week. And so multiplying that out, I was like, I'll be able to help thousands,
right?
Maybe not even 10,000 people. But what I've learned over the past 8 years since I graduated from PT school, and 16 years since I've been studying human movement, is that if we don't really get down to the core of the issue, you're not going to see improved outcomes. And I really want to help people on a level of feeling they've got hope and a better outcome. And I wanted that capacity to reach more people who could then reach even more people. And you talked about you wanting to help, is it millions?
100 million.
100 million people.
100 million people. Avoid unnecessary surgery and pain meds,
And I thought, how is Erin doing that? By treating patients. And then I realized you were doing something similar by helping other people do what they do best. And then I realized, well, I kind of want to do that, but I want to have my spin on it, which is the pelvic floor, now referring to it as the pelvic core, as a more all-encompassing approach.
Yeah, that's awesome. That's really cool. Was there something that, do you remember, like, was someone say something and like the light like switch went ding, or was, you know, do you remember what that was, or was it, I know it was at that time, but was it like, oh, it was, like, you know what I mean? Like, what, do you remember what that was?
I had an aha moment. I had a couple of aha moments. And the first aha moment was when it was my turn to speak at the mastermind event on the hot seat. I rewrote my question like 17 times because I didn't know what to ask. And I knew I only got one question, and that was really intimidating. And that's not how you typically run your mastermind events, but this is how this one was going. And so I felt like I had to get the questions perfect. So I listened and I rewrote. And finally, when it came to me, I thought, my question was, do I open my own clinic? That was my question. And then the conversation started moving. And I said, well, I might even get fired for being here. And Greg Todd looked at me just so point blank with all the love that comes in his powerful existence. And he said, I hope you get fired.
Right.
And I knew it came from like the most loving place that I started bawling. I was already crying, but I started crying because that was a moment of awakening for me, that I had to move in a different direction. I just had no idea what that meant. Because I hadn't explored what that might look like. So that was a big moment. From there, it took several months for me to actually figure out what I was going to do and how I was going to do it and who exactly I wanted to serve.
Right.
But I think that was the most important moment that really inspired me to consider something that I hadn't even considered before.
That's awesome. That's so cool.
It is.
It took me like 8 years to get there.
Oh, my phone just fell down. I still get chills thinking about it,
yeah.
you know? And I just felt so grateful because suddenly someone gave me permission to go against the rules. It's kind of how it felt. And that was just the first of many, many, many conversations that I had with lots of people, including you, where I needed permission to do something that had never been done before, because I was afraid to break the rules.
Are you a rule follower? Like, do you always follow
not at heart, but sorry. I'm not a rule follower at heart, but I have been in my adult life been trying to be the mature person that I thought I should be. And so I started following the rules more in order to have a certain life of comfort. And no matter what I did, it wasn't fulfilling me. So it gave me permission to kind of go back to the heart of me, which is to be a little risque in some ways of how I think or what I talk about.
Right. That's awesome. Did you, like, I'm thinking, like, did you ever get in trouble in school, like, for not following the rules, or you were just always?
No. It's interesting. It's almost like a paired, like, juxtaposition or paradigm. I can't think of the right word. My brothers were always in trouble. So I learned how to be outspoken, but I was never in trouble. I never had detention. I never had Saturday school. I had straight A's in school. My teachers always loved telling my parents and my coaches how hardworking I was, and I never talked back. And so I think I just found an outlet for how to kind of cultivate that. And I felt like I was losing that the more I was trying to be responsible, get a good job and be an employee and follow the rules and get a 15-year mortgage with 20% down and make sure you get good benefits at your job and invest 15% of your salary into your retirement. Otherwise, you're going to be homeless and, unhappy.
Right.
was basically the message that I got. So it was almost like out of fear, I was moving in that direction. And it just felt like a pair of jeans that never fit quite right. And I couldn't understand why I couldn't make it fit. I kept thinking there was something wrong with me until I met this group with this mindset.
Awesome.
And it was refreshing. Like a big smell of autumn air in the middle of the woods when no one's around. Like when you've been in the city with all the smog and the city smells.
Yeah. So what's changed? Like, you quit your job. What are you doing now? What's changed in your life? Like where, in just a few months,
Yeah. Everything. So that mastermind event was Memorial Day. I flew home that day, Sunday, Memorial Day, and connected with a previous employer to talk about, I went up to you at the mastermind event and I went, Erin, I want to quit my job. And you were like, okay. I was like, but you were like, and do you need me to tell you to quit your job? And I was like, yes. Because I still I needed permission to start thinking for myself. And so when I was flying home, I connected with a previous employer to talk about getting some PRN work. And the very next day I sat down with my manager, and I just so calmly just looked at him and said, it's time. It's time for me to move on. I wasn't even scared about how he would respond, or I just had such clarity that I was going to do something else and it was time. And he looked at me with such an exciting, happy look and said, I'm so happy for you. I knew you were going to do something like this. He said, I'm a little surprised at the timing because up to that point had been a very challenging year in my family and in my personal life. And he said, I'm a little surprised by the timing. He said, but I know you're going to succeed. He's like, I wish you all the best. And it was just the most peaceful ending to something that needed to be done. It was like closing a chapter, starting a new one. And it was just it was almost so seamless that I felt weird about not being dramatic.
Right? It's like you expect it to go one way and it's easier and you're like, wait a minute, there's something like something's wrong. Right?
Yeah. So I quit my job. I started my consulting business. I have been developing several products for my customers, including a pelvic core toolkit with exercises and how to incorporate the pelvic floor and the core into some basic core training and transitional and functional activities. I'm working on a boot camp and some other educational courses for non-pelvic floor therapists to incorporate some of these questions and techniques into their practice to bring it full circle. It's what I want to do is help physical therapists realize that there's this missing piece that no one's talking about, and when they start talking about it, their patients are just going to respond even better because they're going to be looking at the whole body and approaching it from a very collective, holistic standpoint. That this is how their patients are going to get even better, and we're going to have a conversation about pelvic floor that we haven't had before, and turn it into, it doesn't need to be glitchy, not glitchy, catchy, silly. It doesn't have to be silly, although it's much easier to talk about when it is. But bringing it into the practice of practitioners who don't want to specialize, but know that they want their patients to get the very best possible outcomes that they can.
Right. What is it about, I want to talk a little bit more about your business in a moment, but I think this is a good segue into what is it about the pelvic floor, or, what is about it that scares people? Or, is it just the whole taboo sex thing that people aren't in touch with? Or is there something about it where it's I know people are hard. It's not only hard to hire PTs, it's hard to hire someone who wants to treat pelvic floor issues. and people don't go into it as much. And yet it's a very thriving community of therapists and cash practice owners. Like, what is it it's like, what's the roadblock for most people to either learning more about it or teaching about it, making it more part of our curriculum?
I think that it's just such a private area of our own bodies that we don't even talk about it with our friends and our family. So talking about it with our clients, I think it's like a tertiary barrier. So treating pelvic floor, most of the time, that first visit was a visit full of tears, because people were coming to me and to other therapists who had been experiencing something very embarrassing and difficult to talk about for decades. And they either never told anyone about it, or they had told one person and they were dismissed. That happened a lot. Oh, well, you had kids, of course you're going to leak urine. There's nothing you can do about it. Or your only option is surgery. And with failed surgeries, it's, well, what do you expect? You're aging. So there was a lot of shame involved with that. But I just think it's something we don't talk about with our own, like, closest friends and family, because there's this deep sense of potential shame that goes along with what's normal if we deviate from the normal, which we don't even know what normal is. We just assume that if anything's going on with our own bodies, that it's not normal, or just we don't even know what normal is. So how do we know if it's not normal? So I think there's a lot of barriers of just our own bodies and talking about it with other people, but then also just the level of shame that comes along with any type of pelvic floor dysfunction, because those are such assumed basic bodily functions that we should presumably have control over. So it's like, if someone has constipation or pelvic pain, I think that there's this initial stigma of, what are you doing wrong? Whereas when you talk about back pain, people say, well, it's a result of my job or my genetics. Like, they've already been coached.
It's got an external, it can have an easily external reason rather than an internal cause kind of thing.
Yeah, the locus of control, I think, is external versus internal with that. And that's just not there with pelvic floor. And
do you think it's like our society too? I mean, is this the same stigma in Europe or, other countries? Is it as difficult? Do you know?
Well, I've met several pelvic floor practitioners throughout the years from other countries. So Carrie Bowe came and spoke to our team, who has published the most number of level 1A evidence that exists to support pelvic floor physical therapy for incontinence and urinary incontinence and prolapse. So I've spoken with her and some other practitioners, and I think that in the United States, there is a different mentality and approach to it. I just don't know if it's like a cultural thing or a timing thing or both, because Western Europe, many of the countries are way ahead in terms of overall medical care. And like, it's standard care for a woman after a delivery, after she has a baby, to get physical therapy with a pelvic floor practitioner. It's just standard care. And we're still, in the United States, we're still one of the worst when it comes to maternal death with delivery. Like, there are developing countries who have better survival rates. So there's something lacking in both, like, the medical community and I think our society, that's limiting us from even, like, starting to explore this even more. Because I think it's more talked about in Western Europe, at least. Yes. I don't know much about other parts of the world.
So what is for someone who is like, I'm not doing pelvic floor, or it's like, I'm not getting close to that with a 10-foot yardstick. Well, you actually have to still treat a patient, but what are like some of the easy things that they can do to either, I don't know, maybe A, address it, or B, figure out, okay, does my patient even have a problem, in this area? Is
Right.
like, what are those two, like one or two easy things that they can
Yeah.
either ask or, look for to know, okay, is this an area where my patients are struggling and I need to either learn more or figure out how to find someone else to help them?
I think one of the most powerful statements to even kind of open that topic of discussion is to start by saying 4 out of 5 people will experience some form of pelvic floor dysfunction in their lives. So it's whether you think it's happening or not, it is. And the statistics aren't going to be accurate in saying 4 out of your 5 patients are going to have some form of it. But know that in our lifetimes, 4 out of 5 people are going to experience some form of it. And that's the number one reason people are admitted to nursing homes, is because of urinary incontinence.
Mm-hmm.
So it is an issue that is going on, first and foremost, just to kind of open that topic. Second, if anyone is doing any sort of balance or performance or core training, if the pelvic floor isn't involved in your cueing, you're missing a big part of it, because the pelvic floor is literally the bottom of the core. Mm-hmm. And if you're not using some basic words, then your patients are probably missing out on a big part of that aspect of pain, performance, power, strength. So those are important to consider. Mm-hmm. And a lot of people, I'm finding that a lot of people aren't ready to just start straight up asking patients, do you leak urine? Do you have prolapse? Do you have pelvic pain? Do you have bowel dysfunction? And so I think that those are all great questions, but maybe not in the beginning. One thing is, if a patient offers that information up, hey, I leak when I do my double unders, or I leak when I do my box jumps if they're in CrossFit, or I can't jump on the trampoline anymore ever since I had babies, because they might not even use the word, but mm-hmm. they'll kind of insinuate. So if anyone's offering you that information, that's automatically a sign that they trust you and they revere you as a professional, mm-hmm. highly trained, and they're trusting you with something very vulnerable. So if people are offering that information, that's a great time to start just incorporating some simple things. But if you're treating back pain, hip dysfunction, any sort of sacral or pelvic issues, groin issues, I wouldn't guarantee, but I'm going to go ahead and say I would be 90% confident that their pelvic floor is going to play some role in it.
Yeah. What happens, like, so I think, for instance, I talk a lot about how I've seen patients who've already been to PT or surgery and massage and all that stuff, and they come to see me, and I'm like the first person that's seen them. And I know, like, and I want to try to give a relation, like a analogy, and it's not my analogy. I want to try to dig the analogy out of you. So it's something like this: like, I see those people and I touch them using my hands-on techniques, and they're like, "Wow, this is the first time anyone's ever touched me where it hurts." And I recognize that some of the pelvic floor therapists I know here in town and around the country are seeing people who are so far down the road that it's like it's like even a further last stop than LeBauer physical therapy is. Just like, they're like, no one knows what they're doing, but they have this problem. And so they're seeing people that have had issues for so long, or just super chronic. But I'm sure there's a segment of the population you've seen or been treating in your time where it's like, oh, no one ever did this with me, and now all of a sudden I can do X, Y, and Z. Is like, like,
Mm-hmm.
Can you tell me what's the analogy side to that? Like, what is it that you're seeing, or you've been seeing in your career, that people are like, oh, we did the pelvic floor thing and now I can it's not even because I was leaking or having painful sex.
Yeah. So one thing where I started, which I loved being able to do, was collaborating with, at my previous employer, everyone was like very specialized. And so we had people who treated hips and knees. We had people who were spine specialists. We had the pelvic floor specialists. And so all of your patients fell into like the diagnosis for which they were being referred to PT, you know, you treated that. And with a few colleagues, I was working really hard to collaborate that like ortho pelvic floor model. And they would begin to recognize like the non-pelvic floor PTs is what I refer to them as. They're specialized in everything else. Is they would realize, hey, this patient, they have back pain and my traditional methods aren't helping them get better, or there's this one thing that's still bothering them. And they started asking me to do like a consult or a 1 or 2 sessions with them. And I had no problem asking those questions. And they were even like informed, like Nicole might ask you some uncomfortable questions and she might offer to do an internal exam. But with them, I think what helped was knowing like if my traditional techniques weren't getting the results, they started to think pelvic floor on the back end. And then a few of the therapists whom I was really good friends with, and we spent a lot of time talking about it, they started incorporating pelvic floor cues early on, and noticed that they were getting quicker, better outcomes. So one of the therapists was a certified Pilates instructor. So she taught a Pilates-based core technique that included cueing the pelvic floor muscles with the entire core and a breathing technique. And people felt more stable with that way of engaging the core. So as someone who's not going to go straight in and just start asking questions about the pelvic floor or doing even pelvic floor examination, that first inkling of if they're not getting better with my traditional techniques, there's probably something going on literally deeper, the pelvic floor is deeper. But then early on, incorporating some simple cues into some exercises that can help people become more aware of their muscles down there and how to train them if they're not already working in coordination with the rest of the core muscles.
Yeah, and for just like simple balance stuff, or even like you know, deadlifts and other crazy things.
Everything. So the research is growing more and more and more, and there are people who've identified this and their voices are getting out. Is anytime that you're walking, the pelvic floor, when it's healthy, activates before heel strike. You don't think about it.
Yeah.
If you have pelvic floor dysfunction, it activates afterwards. So it's a delayed reaction. So it's a timing issue. So that's going to work anytime you're doing walking, balance, running. Those muscles are working in conjunction with the ground reaction forces, the intra-abdominal pressure, the changes in the mechanics of the joints, all the way up the chain, from the foot all the way up. And so as much as core has become a buzzword, I think the pelvic floor as part of the core serves an even more vital role with any of those things. And then with power and athletic performance, there have been several professional Olympic athletes who've documented their journeys where after they had females, after they had kids, they had some issues, so they went and got pelvic floor PT, and then they were doing even better. Triathletes having PRs after children, and making that connection that they felt like they were able to generate more power because they were really using their entire core.
Right.
So anywhere from your basic function, from standing up from a chair to deadlifting 300 pounds and everything in between and beyond, the pelvic floor is working to some capacity. And if you are aware that your patient has some sort of weak core, everyone identifies it in a different way, then the pelvic floor is having issues as well.
Yeah. So
and there's a real simple cue.
Yeah. What's the most simple cue? Like what could we like, I'm gonna get back to the business side of this, but I think this is also like just very interesting and important to me too. But so what's the most simple cue that we could give someone to activate their core or pelvic core? Yeah.
I love pelvic core. I'm loving that word more. So there's a whole series of like active exhalation to activate the entire core, thinking of it as a box.
Mm-hmm.
But just for people to start thinking about and identifying those muscles, they're the muscles that for females, they close the openings down there, the urethra, the vagina, and the anus. And for men, it's pulling that turtle into the shell.
I like that analogy.
Yeah, Paul Hodges, his group, I think he worked with Diane Lee, they came up with that and realized that cueing for men just works. It's like, okay, I got it. Sometimes it takes women a little bit longer because they can't see anything.
Yeah.
And people automatically assume that to do a pelvic floor contraction, it's like moving a mountain. And so they often use other muscles like their glute muscles and their hamstrings. So the most simple cue is just closing those openings and doing a real gentle squeeze and lift. And that's a real simple screen. Can you feel that? Can you find it? And then can you release it? And then one level further is now can you push down as if you were going to push into the chair? That's the whole like range of motion of those muscles. But the most simple cue is close the openings and do a gentle squeeze and lift, or pull the turtle in the shell.
Yeah.
And gentle, it's always like 20 times more gentle than clients think it needs to be.
Right. That's awesome. That's awesome. And I guess like kind of the big take home is if we're not addressing it, we're not gonna give our patients as much as they could get out of therapy, which then hopefully if we give them more and we can recognize more, then our outcomes will be better. We'll have more success long term with our patients, and even maybe get better testimonials and things like that down the road.
Absolutely. I mean, the potential benefits of this for physical therapists and practice owners is tremendous, because it's kind of like it could put the icing on the cake. As you've spent thousands of dollars learning all these techniques, and you are amazing, and it can kind of help those patients that struggle or patients who want to get even better get there. It's going to improve your reputation in the community. And if you connect with a pelvic floor therapist, they would more than likely, I guess I shouldn't speak for everyone, but if in my situation, I had a 4-month wait list. Yeah. If someone was willing to work in conjunction with me, I would have loved to do that, to kind of take some of my workload off and then refer back and forth. So it can increase referrals, it can increase your reputation in the community and improve your patients' outcomes. And like you said, satisfaction, testimonials.
Right.
Businesses thrive in this model.
Yeah. As a practice owner who's not a pelvic floor therapist, what's the number one question I could ask you if Nicole was the practice owner who is a pelvic floor PT, or just even like as a staff physical therapist at the hospital in town? What's the number one question I could ask you to approach you with that would start a relationship where you might send me patients and then I could have a place to send you? As you, as the receiving person on the end of that relationship, what would you like me to ask you to get that conversation started?
The first thing would be to say, hey, I'm starting to consider pelvic floor as a potential issue with some of my patients with non-pelvic floor identified issues. And I'm trying to learn a little bit more about it. So I wanted to reach out to you to see if you had any recommendations of things that I could incorporate or ask my patients. So first asking them if they have anything to offer you. And then also saying, I would love to have someone to refer patients to when I feel that this is out of my scope, so to speak. Is that something I can do? Can I send you some patients your way when I feel like I'm there's something more that I don't quite understand.
Mm-hmm.
So that's a good way to approach it, I think, and a good question.
That's awesome.
Because more than likely they'll have patients that they'll want to send to you, because what I've found throughout the years is that when you treat someone, when they come to you for pelvic floor issues, you can't approach them just looking at those muscles. You have to look at the whole body in terms of the orthopedics and the, whatever your approach is. Everyone has a different approach, but you have to screen the hips, the sacrum, the pelvis, the spine, the fascia, the soft tissue, the ligaments, the muscles. And you often end up treating 7 different things in an attempt to help their pelvic floor get better.
Mm-hmm.
So it kind of is like a mountain turning into a molehill with a lot of these people, because it's gone on for so long and they've developed maladaptive movement patterns and, just other strategies to get things done, because that's what the body will do. So my guess is that they would probably love to do some referring back and forth, because they're probably feeling a little bit overwhelmed with everything that their patients are experiencing. And while they're capable, almost all pelvic floor therapists have strong orthopedic backgrounds. They usually really enjoy focusing on the pelvic floor.
Well, I can see also that there's also this triage of, I'm one of the few people that's willing to treat this. So why am I going to do a mechanical knee pain? It's like, let's address what I can address and then find the other person who's going to help with the ortho issue, and we'll work together, because no one else is going to, no one else is willing to do this right now for these people. And you're not the only person with a 4-month wait list. World of Cure has easily 6 weeks. I know pretty much everyone I've talked to who's got a pelvic floor practice that's a year old has a wait list, and it's pretty, which is incredible. And it's like, we need more people willing to work on these issues.
Mm-hmm. Yeah, I always envision just like this marriage or like bonding of specialties, which I would love to see more of. And it was something I was really trying to do before I stopped practicing as a clinician. And I just ran out of time in the day because I had patients to treat. And I think that's the big thing, is seeing the opportunity for more collaboration with this. Is I don't invite people to become pelvic floor specialists if that doesn't appeal to them wholly, because it is a very unique calling. But I think that there's a huge opportunity to sort of, so to speak, bridge the gap of these areas of the body that all work together. And in the end, it is for the patient's benefit. It's for their outcome. And sometimes we just can't see obstacles if, we don't have that lens.
Yeah, that's awesome.
So
that's cool. I want to kind of touch back on something I mentioned in the beginning. And one of the reasons, like, we were chatting the other day and I was like, we got to get you on the podcast to talk about this, because you're not the first person. But I think so. The other day we were chatting, and I think you had a coaching question, and we were talking, and what happened? Like, I can't remember how we started. It was something about, like, what are people, afraid to charge $200 for? And I think part of it is, as a hospital, you're in a hospital in PT, you were talking about how much the hospital is charging and how people were, coding pelvic floor is always the easiest game to play, and what people are and the bills people are getting stuck with. And so can you share a little bit about your experience with that? And because I don't have an experience working in the hospital as an orthopedic PT and having these things, it's, so that perspective was I've seen it, it's opened my eyes a long time ago, but just reassuring to me that we're all on this right page, no matter almost like how many hundreds of dollars we're charging, because people are getting billed thousands of dollars.
Thousands. Yeah. I had, over the course of 5 years, I had about 4 to 5 patients who had denial of treatment based on coding issues, and also plan of care issues. And pelvic floor is unique in this, in that most of the diagnoses, at least in Michigan, that pelvic floor therapists treat are not covered under physical therapy services. You cannot treat your stress urinary incontinence or vaginismus or constipation, outlet obstruction, constipation. And so there was this little game that we were always trying to play, was what diagnosis code to use. And we often would refer back to muscle spasm or muscle weakness or coordination of muscle, which was a generic diagnosis code. And then what we would struggle with was if they required a specific body area, there was no code to add on to that for the pelvic floor. And so I spent probably 1 to 2 hours a week dealing with this every week, is recoding things. And those 4 to 5 patients, I completely recoded everything in their notes and their plans of care and had them all signed, and they were still denied. And what I found out through that was that at Michigan Medicine, they charge about $400 per 15-minute unit. And so denials based on coding issues of this isn't a physical therapy covered benefit, that was getting passed along to the patient. And so there were patients that were getting bills for my services, over $1,000 per visit.
Wow.
And it was the most heart-wrenching conversation that I would have with someone was, I don't know why this is happening. I've done what I could. I've written letters to your insurance company and they're denying it. And you're left with this massive bill when you thought your copay was $25 or you had a co-insurance of 20%. And it was just heart-wrenching because they would be left with thousands of dollars of bills that they were responsible for. And every time it happened, it moved me further to the CashPT model, and further away from being part of the problem. And ultimately, I knew I ended up having to leave a cat. Aside from wanting to have bigger impact, I just couldn't sleep at night anymore, knowing that someone might potentially get a bill for services that I would never in a million years charge $1,600 per hour.
Right.
So when I came to the CashPT world, understandably, physical therapists are struggling with charging $100, $150 an hour. And I just found it important to point out that the value is there, because all of the CashPTs I've met in this group, at least, have spent so much time and money on their education and their skill set, and also really care and spend time with their patients. And they feel horrible about even the prospect of taking advantage of someone. But I wanted to point out that the value is so much more than we even give ourselves credit for. And that the value is there when people are afraid to charge an entire plan of care what a hospital system would not even bat an eye over charging for one visit.
Right. Yeah, it's insane. I mean, yeah, and I get it. And thank you for that perspective, because it's, I think it's really important to point out, and we kind of lose sight of it, especially even as employees. We don't always know what people are getting charged. And it sounds like because of the coding issues, you had a little bit better or more knowledge of that than I think a lot of PTs I've spoken with.
And I've had the benefit of working at a hospital system outpatient clinic, a private practice outpatient clinic, private practice outpatient clinic with a silent corporate partner, and I managed a private practice clinic. And I have, through some of those things, been given like they did an analysis of our billing at U of M once. I was billing $50,000 a month, and reimbursement was about 42% of that. So, but still a little less than half, so a little less than $25,000. And I was getting paid, I don't know, $6,000 a month or something. So the value is there, but we just don't even see it. And then I worked in a private practice and saw all the numbers, and some insurance companies like HAP in Michigan, they reimburse $42 per visit.
Yeah, no matter what.
No matter what you do. Or they dictate you can do one code of this, one code of that. You know, so insurance companies are dictating the care or the timeline. There are certain policies in Michigan where you get 30 days for your entire physical therapy for the year.
Wow.
Or 60 days.
Yeah.
There are Blue Care Network plans.
And then, but beyond that, you could choose to be self-pay, but people don't see, it's like almost like not even presented that as an option, I think, in some cases, right?
Yeah, I don't think, at least in the larger hospital systems, it's not an option because they don't have a self-pay option. Yeah. In the private practices, you're seeing that more when they're insurance-based, but it's a conversation they're not having until the very end, until benefits have been exhausted, and they want to help that patient transition to like a transitional program for athletic function or whatever they're trying to get back to. So it's a conversation that's happening sometimes in some clinics, but not until the end, when the conversation is almost a moot point about why continue now. If my benefits are exhausted, that's the end.
Right.
So that conversation needs to happen a lot earlier if that's the model.
Yeah. I mean, we could probably go a whole nother hour about.
I feel very passionately about it. That's for sure. I could talk on and on.
Let me ask you this. For anyone listening who's like, okay, you know what, I don't want to own a clinic, or I want to transition from my clinic to doing more online business consulting, helping other, like helping patients, but not doing direct patient care. Like someone who doesn't want to own a clinic and wants to start a business in healthcare or healthcare education, like what you're doing, what would be the number one piece of advice that you would have for them based on, your experience so far with this?
If you want to have an impact, I say you need to get on social media. That's where our voices are right now. Nobody's watching TV. If you poll a room full of people, hey, this morning, what'd you do? Did you go on Facebook or did you turn on the TV in the hotel room? It's astronomical that people are going on social media. So that's where our voices are. And if you're passionate about something aside from treating patients, that's where you're going to connect with those people. So I would say get online and start talking about something that you're really passionate about. Yeah. Because that's where it comes from. If you're not passionate about something, you're just not, you're going to let fear dictate what you do more than the passion of wanting to get your message across and helping people. So I think that's huge. That's awesome.
That's awesome.
And learning to talk to the people you want to help the most. I think that's been such a struggle for me, is I want to help everybody. And I don't know who this quote originated from. If you help everybody, you help nobody. So it really is key to find out who you want to help and in what capacity. Almost more succinct than you really are comfortable with going towards. You can always kind of bring it back a little bit, but you just can't get any traction or ground if you tell everyone you can help everyone, because you're not going to have a direct message or a clear message about what you do and who you help.
Yeah, no, I absolutely agree. That's awesome insight. So Nicole, if someone wants to get in touch with you about any questions or connecting with you online to learn more about the pelvic core or how they can incorporate some of those things in their business, or for other questions, etc., where do we find you?
The easiest way is my Instagram handle is @pelvicfloorexpert, and I'm on Facebook, and we're currently kind of redesigning some groups and my business page. So it might be different than the name that we're using now. Right now, it's called Male PTs.
Yeah, we'll put the link on the show notes page too.
Yeah, but there you can reach out to me on Facebook as well, and Instagram, and my website has my contact information on there, which is www.drnicolecoleman.com. No H.
Awesome. Awesome. Well, Nicole, thank you so much for joining us today. This has been a very insightful conversation for me, and I'm sure for some of the listeners. So thank you for your time. I really appreciate it.
Thanks, Aaron. I appreciate it greatly. Keep doing what you're doing. You're
Thank
changing the
you.
world.
Trying one day at a time, right? Awesome. Thank you so much. Well, for the CashPT lunch hour, this is Aaron LeBauer and Nicole Coleman. Y'all have a great day.